Hello, and welcome to Serenity Vape. This time I'm going to tell you about some of the evidence for CBD's potential role in treating substance abuse disorders. For right now, there isn't sufficient evidence to say CBD will become part of official treatments, but we'll look at how its effects can change how the brain and the body respond to addictive substances like alcohol, opiates, and even methamphetamine. It even looks like CBD can help the brain recover from certain drug and alcohol-related damage. For now, in the United States anyhow, only one brand of CBD has FDA approval for treating drug-resistant epilepsy, and that's it. No other conditions. There are few clinical studies of how CBD can affect humans struggling with substance use disorders. The evidence from animal studies is promising, but as far as human studies go, it's looking like CBD won't do too much on its own. Before I go any further, I want to say this. There is a difference between being dependent on a drug and having a substance use disorder. If you need something to function, then you do. Fundamentally, we want to feel balanced and healthy. We seek to relieve tension, to eliminate toxins, and to cope with trauma. We're looking to repair and restore ourselves, to supplement what we lack enough of. Drugs are not good or bad, they're tools. Problems start when medicine is abused or taken compulsively, but there is support out there when that happens. Now, that said, regarding research on CBD and substance use disorders, I'll put my cards on the table. So, when I started researching CBD and saw claims that it could help mitigate addiction, I got super excited. I'd heard about research that CBD affects our memories, making us less likely to react to specific visual, auditory, and situational triggers. I'd even read how researchers were trying to use it to get mice to stop using cocaine. Of course, those same researchers got the mice hooked on cocaine to begin with. Basically, the evidence sums up like this. We know CBD changes how people react to addictive cues, like pictures of drugs or a particular environment, like a club. But we aren't sure if it will help with withdrawal, though it does seem to make withdrawal from certain drugs less painful. Studying cannabinoids and their ability to affect cellular behavior leads to the development of specific compounds to activate and regulate the endocannabinoid system and improve or alter homeostasis. But tinkering with our bodies this way proves tricky, even risky, and researchers still aren't confident on how the entourage effect, which is to say the effect that multiple cannabinoids produce, works, or how to replicate it. I thought the most interesting research was CBD's effect on alcohol use, but there is also research into its potential to change how we treat other substance use disorders. All in all, though, there's not yet the hard scientific evidence that any CBD company could use to say their product will help treat addiction. Although I absolutely see why they would want to say so, and I'll explain. What the evidence does point to is that CBD makes it harder for the brain to notice addiction triggers, almost normalizing a person's response. Theoretically, it should also help with withdrawal symptoms because of its ability to inhibit the immune system's inflammatory action, but this isn't always the case. Let's first go over where CBD binds to in the endocannabinoid system and beyond. CB1 receptors are more abundant in the central nervous system and the brain, while CB2 receptors are more abundant in the immune system and the organs. CBD binds to both the CB1 and CB2 receptors, but it doesn't bind that well to the CB1 receptors. It binds just off the main part of the receptor. Depending on the dose, by binding to select serotonin receptors, CBD can inhibit the amount of serotonin your body reabsorbs. This is good. If too much serotonin is reabsorbed, there isn't enough floating around to do its job regulating mood, appetite, digestion, memory, and so on. And then depression happens. CBD isn't really an antidepressant, but it's something of an amateur one. CBD has also been shown to have some effect on our dopaminergic neurons, Basically, it has a positive effect on the neurons responsible for producing and releasing dopamine. Now, this is a mouthful. Transient receptor potential vanilloid protein receptors, or TRPV receptors. Some of these are related to how we perceive pain, and by binding to these sites, CBD can help block pain signaling, which is how it works as an analgesic. It also has action on glutamate receptors, and by doing this, it can inhibit the amount of energy-carrying calcium ions floating about and sending energy through the body. This is part of its antioxidant function, and this prevents the body from producing too many reactive oxygen species that can damage cells. In the case of epilepsy, this prevents energy from cascading throughout the brain, thus stopping a seizure. Now, CBD isn't the only cannabinoid that works in the multiple sites of the body, and this is why we're still coming to understand how the entourage effect work. In animal studies, it looks like CBD can help. It decreased how motivated lab animals were to use alcohol and reversed the damage to their livers and brains. In a 2018 study by Cuevas and their colleagues, rats were given relatively high doses of CBD via a topical gel. They were given an alcoholism-inducing amount of, alcohol for about a month. The CBD helped them recover and resist the urge to relapse. It also reduced their anxiety, and it reversed liver and brain damage. CBD's neuroprotective antioxidant properties reduced alcohol-induced death of neurons in an experiment by Hamelink in 2008. In animal models of hepatic encephalopathy, which is liver damage that causes the brain to function less because it's loaded with undigested toxins, CBD significantly lowered the cognitive impairments normally caused. Now, let's pause for a second. In some of these studies, the mice received what are pretty heavy doses of CBD, sometimes higher than 15 milligrams to a kilogram. If I took a dose at that same ratio, I'd be taking 1,000 milligrams of CBD. A bottle of 1,000 milligrams of pure, isolated CBD can cost as much as $50 or more. Such heavy doses consistently cause side effects in one study on Parkinson's patients. It is possible that the carrier oil like olive oil, sesame seed oil, or even hemp oil could add to those side effects. We don't see the same side effects, however, when using topical gels and ointments. Typically, human clinical trials use doses of 300 to 800 milligrams, which are usually well tolerated. When I was researching this, there were hardly any studies on the effects of CBD on alcohol use disorder in humans, and 2 of those studies were still recruiting participants. It's possible, however, that CBD can still help. Alcohol use disorder is often bound up with anxiety, depression, and chronic pain, and there's evidence that CBD's anti-anxiety, anti-inflammation, and antioxidant effects, as well as its ability to slow serotonin reuptake in the brain, could make it a candidate for using alongside established treatment options. If it works, it works. However, there's no evidence yet about its effects on human alcohol use disorder. There are, however, studies on CBD's ability to reduce cravings for other drugs. You might think this sounds crazy, you might not, but it turns out that THC can be addictive. I'm suspicious of this as a diagnosis because it smacks a bit of that stigma that created films like Reefer Madness and the multi-trillion-dollar war on drugs. However, suddenly stopping smoking pot after using it daily or, fairly regularly can cause withdrawal symptoms, the same physical and psychological ones that are caused by suddenly stopping other drugs. And it can reduce the amount of type 1 cannabinoid receptors in the body, thus inhibiting nervous system function. That's probably temporary. It's estimated that 8 to 12% of cannabis users develop cannabis use disorder. The number might be higher. Those people certainly are. Good news, though. CBD, the second most abundant cannabinoid in our friendly favorite green plant, isn't addictive, and it actually has the potential to block the habit-reinforcing qualities of THC because it disrupts how we perceive different stimuli. In a way, it makes things seem new, divorced from the usual responses we have. It has a low affinity for CB1 receptors. It doesn't bind directly, as I've said before, it kind of just hangs out toward the side of that receptor. And that's where THC normally likes to bind. It does like binding to other receptors, though, as I mentioned before, and, reduces anxiety, pain, etc. The human research on CBD for opiate addiction is in its infancy still, but it's moved into human trials, so it's safe to start getting excited, I think. In 2015, Yasmin Hurd and her colleagues found that CBD reduced cravings in study participants for up to a week after therapeutic dosing. While the doses they tested were seemingly high, 400 milligrams and 800 milligrams, what stands out to me is that CBD reduced cravings for up to a week after the last dose, as other studies have found. There's also evidence that it makes withdrawal from opiates less of a burden, something I noticed in a review from 2018. CBD use while using opiates is generally safe and doesn't make the negative effects of fentanyl worse. In this particular study by Yasmin Hurd and her colleagues, CBD was given first an hour before the fentanyl. As usual, they found that the patient's blood levels of CBD reached their maximum after 3 hours. CBD was still in their blood, though, after 8 hours. Unlike with alcohol, CBD doesn't make the seductive effects more pronounced. In this study, and in general, CBD side effects, compared to many prescriptions anyway, are mild. In 2018, Chandni Handocha and her colleagues did a placebo-controlled, double-blind, randomized study with 30 participants to see what effects CBD had on cigarette cravings, withdrawal, and attentional bias. The main finding was that the CBD lowered attentional bias to visual cigarette cues, but it didn't affect cravings or withdrawal, and there was no change in whether or not people kept smoking. Participants received either 400 milligrams, 800 milligrams, or a placebo before being presented with neutral and cigarette-related cues. CBD reversed attentional bias, meaning they weren't automatically looking for it. This is kind of what they're finding with CBD and other drug use disorders. It just neutralizes the images that normally worsen cravings. As a smoker, I caught myself reaching for another cigarette when a friend lit one, and another friend would light their cigarette and still be smoking by the time I was done with mine, so the rest of us would relight, and soon enough there was nothing but smoke for miles. Taking CBD before a situation like this might prevent me from smoking more. Then again, I quit smoking cigarettes regularly quite a while ago, so maybe the CBD helped with that. I'm actually going to hit the brakes here for now. When I return to this topic, I'm going to give you a look at CBD's potential effects on other drug use disorders, and I'll take more time to discuss what condition-place preferences are and how CBD seems to prevent them from forming or reforming, depending on the dose. It's enough to say for now that studies on CBD and substance use disorders show that cannabidiol has an effect on how the brain consolidates memory and responds to craving triggers. While it doesn't prevent cravings or withdrawal in most cases, its effects on anxiety, pain, and the immune system may feel helpful. CBD may help a person feel better, but it won't cure or reverse a substance use disorder or the damages caused by substance abuse. In the animal studies where CBD did extinguish addiction or reverse cell damage, the doses were massive. For example, a dose of 20 milligrams to a kilogram, such as the rats received in the study on alcohol use, translates to a dose of over 3,000 milligrams for a 150-pound person. However, the doses used in most human clinical trials are significantly lower and still show positive results. Those doses are 300 to 800 milligrams usually. Now, just a reminder, 1, I am not a doctor, and 2, CBD will not be a one-stop cure-all for any condition. I do hope that this information has been useful to you, and until next time, stay safe and vape on. Thank you for stopping by. I hope to see you next time. Stay safe and vape on.